media as well as traditional media to get the word out. So that's not an exhaustive list, but though that's the kernel of the actions that we're immediately taking as the CTO and the CHDA. Thank you.
Thank you, Dr. Ingar and Mr. Hugh Riley, CEO of the Caribbean Tourism Organization. It is my pleasure to now invite Dr. Derek Evans, ethicist of CARPHA, to provide you with some insight on how to better treat with ethical issues that may factorize. Dr. Evans.
Thank you very much, and special hello to all persons across our Caribbean region. There are some important ethical issues to consider regarding Zika virus infection in the Caribbean. To limit the effects of any possible epidemic, good early communication and adequate community engagement and collaboration are required. Our communication must therefore outline sufficient details for persons to realize its relevance to them individually before the onset of the illness within their country or their community. And so, at the governmental level, good, helpful communication, information about the Zika virus, and effective measures to minimize infection through eliminating mosquito breeding sites and measures to avoid being bitten by a mosquito should occur. This helps to avoid confusion, miscommunication, and misunderstanding. Further, as in every infectious disease, our relevant authorities should not downplay the risks, as this could lead to higher rates of preventable infections. Neither should we overstate the risk, as we would not want any panic or any lack of public trust occurring subsequently, as this can be long-lasting. It is always good to provide timely, adequate, and appropriate information, as we are now doing. And so we are telling you of the nature of this disease, the types of interventions to be implemented, and the reasons for these interventions. We should always have a proper balance and avoid politically polarizing positions on health matters. Further, our Caribbean countries have an obligation to reduce the risk of ill health that people might impose on each other within as well as across borders. Medical practitioners also have the responsibility to inform and counsel their patients extensively on this matter, and to work with their ministries of health to minimize the effects and avoid unnecessary alarm concerning Zika virus infection. Please go forth and deliver this message.
Thank you, Dr. Aarons. Confirmation of Zika in several Caribbean territories. I'm pleased to invite Director of Surveillance, Disease Prevention and Control, Dr. Joy St. John, to address us on surveillance and strengthening our health sector response. Dr. St. John.
Thank you very much. As Dr. Hospitalis has told you, Zika virus has been identified in 20 countries, including 4 CARPHA member states to date. Given the existence of a competent vector Aedes aegypti in most countries in the region, there is a high probability that Zika can and will spread to other countries in the Caribbean. Public health surveillance is a key strategy in the fight against any disease and entails the ongoing scrutiny of all aspects of spread of a disease pertinent to effective control. Key is a high index of suspicion by health providers. For example, to take a travel history in patients presenting with a Zika-like illness, as well as environmental surveillance. Before an area or country is declared to be having local spread or an outbreak, the laboratory confirmation is critical. In light of this possibility of spread, CARPHA has developed the capacity for Zika virus testing and has been actively engaged in the testing of samples from many member states as they step up their surveillance activities focused on detecting the arrival of this virus to our collective shores. At this time, polymerase chain reaction PCR testing, capable of identifying genetic material of the Zika virus, is the only reliable test for the virus. Antibody testing is less conclusive because a large proportion of the populations in our member states will have antibodies to other similar viruses, like the dengue virus, endemic in many parts of the region, and that can confuse test results. So as a result, testing of samples is limited to those which have been collected early in the course of the illness, within the first 3 days, I repeat, within the first 3 days, when levels of Zika virus are highest in the bloodstream, so that PCR testing can pick it up and be specific. Please ensure in your countries that there is adherence to our packing and shipping guidelines. As well, if there are cases which need further discussion because of peculiar circumstances, we stand ready to provide clarification and guidance. It is important to note that the laboratory testing for Zika virus is geared towards the diagnosis of the outbreak at the initial stages, and therefore once the outbreak has been established in your country, it is not necessary to identify every single case of Zika virus that occurs, as many people have mild disease and may not come to clinical care or require a test at all. A large proportion of persons who contract Zika will not know that they have it. The numbers of clinically confirmed cases are therefore not intended to reflect the actual number of cases in any given country. Rather, lab confirmation of Zika virus circulation is meant to keep track of the appearance of Zika in new areas and provide updates on the spread of the virus. In most cases, physicians will need to use clinical criteria, that is, patients' signs and symptoms, as well as epidemiological data on the circulation of Zika virus in the areas from which their patients present, in order to come to a diagnosis of suspected Zika virus. Special attention is warranted in the follow-up of patients for varying types of neurological sequelae after Zika virus infection, and particular attention should be paid to follow-up of pregnant patients who present with febrile illness compatible with Zika virus, and their offspring, in light of current concerns regarding a potential connection between Zika virus infection in pregnancy, especially early pregnancy, and the development of microcephaly in infants of affected mothers. CARPHA is currently in the process of piloting systems to facilitate the documentation of such cases should they occur, so as to detect any similar patterns of association in the Caribbean region as early as possible. Barbados has been chosen as a pilot site for this activity, which is occurring this week. It is important that we follow the course of this disease in the Caribbean very closely from more than one perspective. The first is that it is new to this region and its potential impact is still largely unknown. The second is that we must provide the best epidemiological data in order for countries to keep abreast of the best practices in addressing the clinical manifestations of the illness, as well as the best practices in vector control. To this end, we are also requesting that countries send specimens for severe cases of Zika, especially hospitalized cases where Zika infection is suspected. We will be working through the ministry's vector control programs to ensure that vector control around health centers is optimal and healthcare workers themselves are using the correct precautions. Third, is the potential for a negative economic impact on our heavily tourism-dependent countries. Thus, we partner, as you have heard, with the regional tourism entities like CHTA and CTO to provide them with timely data and guidance to achieve the best approach to mitigating the negative impact. CARPHA looks forward to maintaining an open channel of communication with the media and member states as the Zika epidemic unfolds, and we anticipate the cooperation of all the stakeholders in ensuring the most evidence-based response to this rapidly developing situation. Thank you.
Thank you, Dr. St. John. We have received quite a lot of information, and I am sure that you have questions. So I would now like to open the floor for questions from the media. I'm told that the internet is now functional. I am unsure as to how many of the regional media were able to link in to the broadcast. But if you have joined us virtually, please feel free to also ask your questions. You may have to type it in, or you may be able to verbally ask the questions, which of course we will answer. I would just like to ask though that you please state your name and the media house that you represent. The floor is now open for questions. Can you wait for the microphone, please, so that we can have the record, your question can in fact be picked up.
So this may sound like a foolish question, right? But I've been bogging my mind out to find out how does mosquito-borne illness spread? Because surely mosquitoes can't fly from country to country. How does it spread from country to country? Is it that an infected person is bitten and then becomes a carrier? Please explain.
Thank you for that question, and there's no question that's foolish. Yes, it is that persons who are infected with the virus can travel because you do not get sick immediately when you get bitten by an infected mosquito, one. And you also have persons who may not have be showing any symptoms who do have the virus. So what you have is that persons are moving from country to country, and they themselves are infected. And then the mosquito in whichever country, as we've already said, the Aedes aegypti mosquito is a very competent vector of the virus and is present in almost all of our countries. And so the mosquitoes are there ready and waiting to pick up the virus from someone and then bite someone else and pass the virus on, because as we said earlier, our populations are immune, so people can get infected that way.
Just a follow-up question. So when mosquito lays the eggs, is the virus also spread to the eggs?
That is something that is still under investigation, because with dengue and with chikungunya, they have found that there's what's called transovarial transmission, where the mosquito can actually pass the virus through to the next generation. But as we said, for Zika, it's very, very new. So it may be possible that in laboratory studies, it may be found, but we have to look into field studies to see if that is happening. But at the moment, the most effective mode of transmission is from person to person via the mosquito.
So if a pregnant woman is bitten by an Aedes aegypti mosquito carrying the Zika virus, is there any intervention that could be done to prevent the child from getting, the baby from getting microcephaly?
Like Dr. Coulson just said, it's early on for us to know. But we do know that several women who got pregnant did not have babies who had microcephaly. So the other thing that I need you to know is that in the test of the ones who did get microcephaly, not every person has had virus isolated. So that's why there is no clear link between having Zika and having a child with microcephaly. It is still something under investigation. So I can't have an answer for you as to some intervention that could be made. That is why we are stressing on the fact that the intervention is not having a mosquito around to bite anybody in the first place. You have to realize that this Aedes is like a very good family friend in the Caribbean now. It's domesticated. It lives around us. It moves around us to work, where we go for recreation. So the whole thing is about getting rid of that mosquito and not having the bite at all.
Hi, good morning. So a lot of them saying, sorry, from Montreal FM. I understand you said that second, the mosquito can, well, basically run from human to human to get into the country, but the Minister of Health, Mr. Terence Jansen, he actually put inspection notice on our ships coming into here. That's where tires coming from Brazil needs to be inspected. So is it that, how's the prevalence, how possible is that to come into here and, insurance?
One of the ways which mosquitoes can move is through what we call passive transmission. And so in the case of the tires, there's another mosquito species that we didn't mention earlier. It's called Aedes albopictus, which has been moved from Asia to the United States through the used tire industry, and also from the United States and so on to other countries. So there are a few countries which have that mosquito vector. That is the one that can lay the eggs in the tire, and when the tires are out in the tire yards, they get filled with water, the mosquitoes lay the eggs, and then the tires are emptied, the water out of the tires are packed into containers and shipped worldwide. But the tires all have some of them would have the mosquito eggs still in the tires, and the mosquito eggs are viable. So if you understand, then the tires are brought, for example, to Trinidad, taken out of the containers, left out in the open, rain falls, water collects, and those mosquito eggs would hatch, and then you would have the introduction of that mosquito species into the country. So in terms of, it links back to the question about if the mosquitoes can lay eggs with the virus in, it's all still under investigation. So in terms of trying to prevent the introduction of mosquito species, that of course is one measure that would be targeted by countries.
Be aware also that the mosquito egg can live for as long as 9 months before it hatches. In a dry environment, it is able to survive.
And with regards to the chikungunya disease last year, is there any report at all that said that how it came into the country, whether it's through the airport, through humans, or whether it's through cargo ships?
I don't think that might ever be known. Chikungunya spread country to country, one a week, one every 10 days during 2014. And actually, if you will, jumped over Trinidad. It appeared to have been in Guyana before it was confirmed here. But I don't think it will ever be possible to figure out just how it came.
Mary House, CNMG, could you list me again the 4 CARPHA member states with the Zika virus?
These are the 4 member states where Zika has been isolated in the samples that were sent to us. Do you understand the difference between what you just asked me and what I said? So the 4 countries that have had Zika virus isolated from the samples are Guyana, Barbados, Suriname, and Haiti.
Once the virus has been seen and it has been identified in a country, what's the next step? What are you all going to advise next? What's the next step?
What we have been advising for several months is that the country's surveillance system should be very strong so that it can track the disease. Along with that, in parallel, is the strength of the vector control program, because I told you, the way to control the spread of Zika is to make sure that there's so few mosquitoes that there aren't mosquitoes to bite an infected person and spread it to someone who's infected. As well, the ministries of health have to issue clear guidance to the entire health sector, public sector and private sector. So from the clinical perspective, they have the index of suspicion to check for if a person has Zika or not, if it's necessary. They also will know that there is no specific treatment, so it is all about reassuring your patient, giving your patient details of what are the things that are dangerous that would require that they come back to the doctor, and also ensuring that the health services are aware that this is a suspected case of Zika. So the health services are able to be sure of the burden. The other thing that the health authorities need to do is to ensure that within the hospital setting, if there are suspected cases of Zika, that these cases samples are taken and sent to us, because we need to characterize how Zika is going to look in the Caribbean. It may look like Brazil or it may not. It may be completely different. There were things about H1N1 in the Caribbean which were different from what happened with H1N1 elsewhere. So it's important for health authorities to give us information that we can then work with to help to characterize what is happening. The other thing that needs to be going on is what has been happening in several countries. They need to be communicating with the general public so that the general public is quite aware that there is Zika, quite aware of what they can do themselves individually to ensure that we have the best approach to vector control. So there are several things that the CARPHA organization has been telling the community, things that have been put in place by countries. And then it's very important to remember the message from the Ephesus, because we do not want undue alarm being raised. It isn't just a matter of the fact that we have citizens, but as we said, we're heavily tourism dependent. So this is part of the reason why we are talking to you. So another thing that is the next step is that CARPHA has to make sure that the press has the right information and has the right delivery of that information, so that although everyone is informed of the correct scientific information.
Something I think the Ministry of Health did last year is sending out public health inspectors when there was emergence of chikungunya. So various houses checking to see if the community health is on any partner. Would CARPHA be partnering with the Ministry of Health in that regard this year?
We work closely with the Ministries of Health and also the environmental health departments. So we give guidance as necessary. So the measures that they were undertaking during chikungunya, and also which would have been undertaken routinely as a result of the fact that dengue is endemic in the region, are the same measures that they would be beefing up. So with guidance from us through the Ministries of Health, then there are standard protocols that are followed, which they would execute.
With the carnival season among us, I just want to know, are we ready? One, and is CARPHA doing anything with the airports in terms of screening or anything like that? Or could screening be done for the virus?
The Trinidad and Tobago has Carnival, as so do most other countries in the region now, which brings visitors from elsewhere in the Caribbean and internationally. As was mentioned earlier, a high percentage of people with this infection actually have no symptoms. So there's no place for screening at airports. It just doesn't make sense. What is important is high index of suspicion, good knowledge of the population, so people are aware, look, I just went to Guyana, I just went to so, and they can take precautions, see their physician, and then avoid getting bitten by mosquitoes for the first week while you have a fever, so you don't spread the disease to family and loved ones. That's a very important message. In theory, as soon as you get fever or your family has it, you can isolate yourself, bed nets, repellents, will greatly reduce the spread. And so the answer to somebody's question about once the first case is detected, you really have to intensify your public health measures, your education, control of the mosquitoes, intensify education, especially to pregnant moms or mothers who are thinking of getting pregnant. How important is the avoid being bitten by mosquitoes? And that's what I would emphasize.
And to add to what Dr. Hospital just said, this is a good opportunity for the media to really highlight our message to travelers, which is actually on our website. We are asking travelers, to be aware, to use insect repellent, to wear light long-sleeve clothing where possible. And if you are staying not just in hotels, we have a lot of guest houses in Trinidad for Carnival to ensure either they are actually screened up or using bed nets if the rooms are not air conditioned. So really it's a good chance to urge our travelers to protect themselves, and as well as the hotel and the guest houses to have a clean environment and to protect the mosquitoes from biting as much as possible.
And we have to emphasize that, as we have seen in other countries, for every 5 persons that have the virus, 4 of them do not show any symptoms. Only 1 in 5 will actually be ill enough to present to the healthcare setting. So there is no need for alarm. 4 out of 5 persons will have no symptoms and go around as per normal.
I think the emphasis for Carnival is protection from mosquito bites.
And sunburn. Much everything else.
So for Zika, the use of the repellent is going to be important. Carnival has evolved into a little clothing zone. So you're going to need to use a proper repellent, which will last for the maximum period, and you're going to need to walk with it or jump with it so that you can reapply as necessary.
And if I can add a plug for foodborne diseases, it's a good opportunity to ensure, hygienic measures are taken during Carnival. Washing your hands and, ensuring that you're getting safe food from safe vendors.
Okay. If there are no more questions, I believe that we have come to the end of the media briefing. I would like to thank you, of course, for your participation, particularly you, the media, local media who are present here. We will have the information available on our website at CARPHA.org for those who were unable to join us via the regional link. I encourage you as well, the media, to follow us on Twitter, where you will be updated on all the information that we would put out, answering responding to some of the misconceptions, and giving vital links to our website and our YouTube channel. I would also like to take the opportunity to remind you as well of the IDB CARPHA signing for the Tourism and Health Grant, which takes place on Wednesday at 9 a.m. So thank you so much again, and we look forward to, I think it's, okay, sorry about that. Yes, I just want to thank you again, and I look forward to having you assist us in submitting the accurate public health messages with regards to Zika. Thank you.